my first questions are about wearing a mask. So one of the community members asked, how should I wear a mask and how long can I use a mask for before changing it?
Yeah, so you want to make sure that the mask is fit snugly around your face, around the side of the face. If it's a mask with the loops, the loops go over your ears. Make sure the mask covers your nose, your mouth, and it goes underneath the chin. In terms of how often you have to change it, whenever you're touching the mask at all, you should probably either throw it away, or if you have a reusable one, you should be washing it. And that's because, if you're outside, sometimes the virus particles will be on the mask. And so if you're touching that, and then you're touching your face afterwards, the mask doesn't help at all. So if you're wearing a disposable mask, once you're touching the mask, you want to dispose of it, and you want to actually wash your hands as well. If you have one of those cloth masks or like a scarf that you're using to wrap your face around, those are reusable, but once you touch it, most people will advise you to actually clean it. And you can clean it just by throwing it into the laundry, and put the temperature setting on the warmest possible, whatever is acceptable for the material that you're using, and then dry it afterwards, and that should be good. So you should be able to reuse that again. In general, we're telling patients, or we're telling people, if you have the cloth masks, use those. The surgical masks in general provide more protection, but I would save those for if you're actually taking care of someone that is COVID positive. So for example, if you have an elderly parent in the house who is sick and you have to go into their bedroom, you have to help feed them, you have to take care of the room and take care of their health needs inside the room, you can, first of all, put one of those surgical masks on the patient, but you can also wear one of those as well.